All right, thank you very much for the opportunity and for speaking to a larger group of people. So I'm actually very delighted. So my name is Moses, and I'm standing in for Global Child Nutrition Foundation, which is an NGO based here in the United States. And I'll be talking briefly about the potential of school meals programs to tackle the rising rates of overweight and obesity in Africa. So we are all aware of the overweight and obesity problem in the world. According to some UNICEF estimates, about 41 million children under the age of 5 are overweight and obese, and about 25% of that number are in the African region, and over 340 million children and young adolescents aged between 5 and 19 years old are also obese. And in the African region specifically, prevalence rates for overweight and obesity among school children have been reported in excess of 10% in many African countries. And the risk factors for overweight and obesity differs in early childhood and late childhood. In early childhood, maternal factors such as maternal weight gain during pregnancy, infant birth weight, and maternal life factors are huge predictors of overweight and obesity in early childhood, whereas in late childhood, modifiable lifestyle factors such as nutritional intake and physical activity are very huge predictors. And so we think the school feeding program or school meals programs have a lot of potential to address the overweight and obesity problem because, one, it is universally implemented in the continent. All 54 countries in Africa has some form of school feeding programs ongoing. Secondly, school feeding programs are usually implemented with some complementary programs, such as school gardening programs that provide anthropometric assessment for school children and also incorporates wash interventions. We also think the school feeding program provides a very unique opportunity for intervening in overweight and obesity prevalence because—
Moses,
yes,
your slides are still on the title, not moving, and it's not presentation mode.
Oh, I'm sorry.
Yeah.
It's actually moving, okay. So I'm kind of surprised. Can you see my slides?
Now we can see. We can see about presentation mode.
I can go ahead with the presentation mode if
that's
you
can
going to be helpful.
Can go ahead.
I can
okay.
Just increase it a little bit. So school feeding programs, like I said, has a lot of potential to address the overweight and obesity problem. And I've mentioned about the fact that it's universally implemented in the continent. It incorporates complementary programs such as school gardening, and school feeding program also provides an opportunity of intervening in overweight and obesity because we can diversify the school feeding basket, and some programs can also modify the school feeding the food environment within the school premises that can help influence food choice amongst their students. And very importantly, by incorporating families and communities into school feeding programs, we think that this program provides a very unique opportunity to encourage healthier eating habits and active lifestyles at home, so that the messages that these children get from the school can be reinforced at their homes and can ultimately help them live a better and active life. So the Global Child Nutrition Foundation is an organization that's been in existence for a long time right now. And in 2019, we found that there was no systematic collection of data on school feeding activities across the globe. And so we came up with the Global Survey of School Meals Programs as an avenue of collecting data on school feeding activities across the world. And this survey is partly funded by the United States Department of Agriculture. And we collect data on the school feeding activities of every large-scale school feeding program in every country. And this data is collected primarily by a government representative who is really well knowledgeable about all the school feeding programs going on in the country. And we use this data to create a unique global database of school feeding programs and activities. And this database is heavily used to report on any information on school feeding program across the globe. And so the survey, just to provide more information about what we collect data on the scope of school feeding in each country in a recently completed school year. So for example, we are actually going to kickstart the next round of the survey to collect data on the 2023 school year. We also collect data on government financing and involvement in school feeding programs. We collect information on the agricultural and private sector engagement in the implementation of school feeding programs. And we also collect data specific to gender-related aspects of school feeding, nutrition, education, and so many other factors, or so many other sectors that are that help to make sure that these programs are successful. We also collect information on jobs that are created and the impacts of emergencies on school feeding programs such as COVID-19, and information on health and sanitation topics, especially those that are incorporated into school feeding programs as a complementary program. And so so far, we've conducted 2 rounds of this survey in 2019 and in 2021. And in total, about 47 African countries have participated in this survey. To the right, you can see the map of the countries that have provided data. And these countries comprise about 89% of the countries in the African region. And of these 47 countries that have provided data on school feeding activities in 2019 and 2021, 44 of these countries has at least one large-scale school feeding program. And these 44 countries in total have 82 large-scale feeding programs. And these 82 large-scale feeding programs in the 47 countries that have reported on the school feeding activities in Africa so far, they provide about school feeding to about 63 million children of all ages across the region. And this comes to a percentage of about 17% of primary and secondary school age children who receive school feeding on an annual basis from the school feeding programs. We also found that the coverage rates vary with income level and across regions. As you can see on the chart, the coverage rates are lowest in Central and Eastern Africa, and the coverage rate of school feeding programs are higher in Northern and Southern Africa. Also, you can see very low coverage in low-income countries and lower middle-income countries, and about 87% of the countries in the African region fall in either of those categories. So we see here that the children who are the most need of school feeding programs are actually the ones who are not benefiting as much from these programs. And in all these programs, so many goals and objectives are set by the countries and the funding partners. And we see that to meet nutrition and health goals is a very huge focus of school feeding programs in the African region. However, to prevent or mitigate obesity, just 10% of the programs in the African region has the goal to reduce the rates of overweight and obesity. And we can see that even with that very low percentage, about no programs in Central and Eastern Africa has a goal to reduce or prevent obesity. And as low as 13% of the programs in Southern and West Africa has that goal. And we find that the programs in Northern Africa were more likely than the programs in other regions of Africa or sub-regions of Africa to have a goal to reduce overweight or obesity. And for the programs that have this goal to reduce overweight and obesity, we see that nutrition, physical, and health education are the 3 most used approaches to help achieve this objective. However, we find that only 14% of the programs attempt to regulate the school feeding environment, which we know is a very strong predictor of overweight and obesity among school children because of the availability of unhealthy food that's been reported in many school environments. And interestingly, many of these school feeding programs incorporate complementary programs that help to achieve the overall goal of school feeding programs. And between 2019 and 2021, we had 37 countries in the region that participated in both rounds of the survey. So in 2021, we find that about 7 countries reported having new food, nutrition, and agricultural education programs incorporated into their school feeding programs. About 15 countries of the 37 reported having new school guidance. 8 of these countries reported offering health education for the very first time, and about 9 countries reported providing physical education in addition to the school feeding programs. And all of these was not present in all these programs as of 2019. So in each of these cases, we see a very strong movement in the positive direction, where programs are increasingly incorporating these complementary programs that can help improve the health and the well-being of these children, not only by providing school meals to them, but by also helping them with learning about how to eat the right way, improving their knowledge about food through nutrition education, agricultural education, and also physical education to help them live a more healthy and active life. And so our concluding thoughts, we find that the coverage rate of school feeding programs is actually very low in Africa. Just about 17% of the children who should be receiving school meals do receive them. And so there's a need to increase the coverage of school feeding programs in about 80 to reach the remaining 83% of school feeding children. And as I mentioned earlier, our rates are particularly low in low-income and lower middle-income countries that comprises the majority of the countries in the African region. And also we find that the percentage of programs that reach preschool children is almost non-existent, and there's a need to help increase coverage of school feeding to preschool children, because this is a stage where their taste preferences and their food preferences is formed. And so helping them with the right intervention by providing healthy food at that age would help them go on to, appreciate eating more healthy and living a more active life as young children and adolescents. We also think that the potential of school meals programs to reduce overweight and obesity in the African region has not been, fully explored in most African countries, as we saw that only about 14% of the countries had a goal to reduce overweight and obesity. So we want to see an increased adoption of complementary programs, such as the physical education programs that can help to keep students active and improve their health and well-being, and ultimately help to reduce the risk or their exposure to factors that can increase their rates of overweight and obesity. And we also acknowledge that there's a severe gap in our knowledge of the association between school meals programs and obesity in Africa. And this is for several reasons. One, because there's limited long-term studies on school feeding programs. Also, there's a lot of incomplete data on program effectiveness, and most of these programs are not followed over time to actually understand and evaluate the impact of these programs on the population. And also there's possible interaction between school feeding programs and some other programs that may have a complementary or opposing effect on overweight and obesity prevalence. And so what we do as the Global Child Nutrition Foundation, we are leading the charge to gather data on school feeding activities across the globe. And we are continuing this, and in 2024, we are collecting data for the 2023 school year, and we are open to questions, suggestions, ideas for collaboration, and please feel free to reach out. We're happy to collaborate and make sure that every school feeding data in every country across the African region is captured and reported the way it should. And this can be used as a means of advocating for increased funding to the programs, and also to help achieve several goals, including reducing overweight and obesity. Thank you very much.
Thank you so much, Moses. Indeed, you had a much larger audience. Benefit of probably not presenting in your session. And thank you again for reiterating that the school feeding program, it's a wonderful opportunity to improve that quality and probably shift and create demand for healthier food. That's fantastic. I don't know if there are any questions from the audience. A quick one.